I think it's a red letter day or a great day for India. It's a great day for Indian science. I think it is a great day for humanity at large. It is a great day for even the low middle income countries as well, with India having such a large stockpile of vaccines and supplying the 60% of the vaccines across the world for other things. And now with this COVID vaccine, we will be able to establish that as well. The two vaccines have been approved and under restricted use and emergency use authorization, and they have been done with full, tremendous scientific discussions by the SEC on 2 days, on 2nd January and 1st January for 8 hours, and they gave their recommendations, following which the drug controller had further deliberations and has given approval. So this is wonderful news for India. This is wonderful news for all of us. More importantly, we from the Indian Council of Medical Research have been involved with the Bharat Biotech and also helped the Serum set up their 2B3 trial. We've also done the private-public partnership with the Bharat Biotech and have done all the isolation of the virus, to the development of the vaccine, to the animal studies, to helping out with the phase 1, phase 2 and the phase 3 of this study. So this has been a great journey. There have been several challenges, and what we can learn is that Indian government approach has been a very proactive, preemptive approach, whole of the government approach, very innovative and very creative. And this decision is also a very innovative and a creative decision which the drug controller has taken with the scientific experts from the country, and given this approval for these two vaccines when the whole world is struggling with this pandemic. We have fought tremendously with this pandemic right from 8th of June 2020, when the first joint monitoring group meeting was done. Then we had the first cases on 27th of January last year, and now on 3rd of January we've got this approval for these two vaccines, which is, I think, a huge news, not only for India, for Indian science, and also establishes Indian science across the globe, that it is going to be one of the leaders in science across the world. Now, if you look at the Covaxin development, we have isolated the virus. We gave the virus to Bharat Biotech. They developed the vaccines. We did the hamster studies, followed up to day 65. We did the monkey challenge studies. We did the phase 1, followed up to 104 days, phase 2 studies with more than 98% immunogenicity with this drug, with more than 22,000 now in phase 3, with tremendous safety established. So I think this, for the public, I would like to say that we have good news. Having said that, we do have the good news, but we will not change our COVID appropriate behavior by wearing the mask, by having social distancing, by not mixing around too much, and also washing hands regularly and behaving in a very responsible citizens, because this is an opportunity where we are now being able to control the pandemic to a certain extent. With the vaccine, we will be able to control it even more and hopefully break the virus transmission chain. The second point that I wanted to establish was that the new virus variant, which is now more than 60% more infective and is creating havoc in the United Kingdom, having more than 51,000 cases yesterday in the UK and 55,000 cases day before yesterday, with up to 1,000 cases dying per day. That is a worrisome, and we have been able to get 29 patients in India with the same variant. So that is a point of caution, which is worrisome. And again, we have been able to isolate the new virus very soon, from 24th of December till yesterday. The scientists at NIV worked very hard, day in, day night, Saturdays, Sundays, right up to 2 a.m. in the mornings, to isolate the virus. And now the virus has been isolated and cultured, and this will be tested against different vaccines. And we presume and hope that potentially the Bharat Biotech vaccine or the Made in India vaccine will have some advantage, potential advantage over other vaccines on this new strain, because it's a whole virus and it targets all the proteins on the surface of the virus, not just one protein which has mutated the S gene protein which has mutated, and therefore those vaccines which are targeting just the S gene may not work as well. But that is still scientific conjecture. We should not make any conclusions from that. But for the common people, we would like to say that we have now 2 vaccines in our armamentarium, and if we are responsible citizens with COVID-appropriate behavior, we should break this pandemic and we should win the war.
Right, sir. So you said we should win the war. India first got the first case. India was not in condition to beat the virus. You slowly, all the scientific community came together by testing, by PPE. So can you share that little experience of yours?
Sure. I think this is a huge, big experience as far as India is concerned. When the pandemic started, we had very limited number of testing kits, and they were being supplied from countries like China, from Korea, and it was a supplier's market. Immediately we realized that we have to innovate. Our startups, our Indian companies, our scientific community stood up and manufactured Indian kits. We were able to compete with the international kits. These kits were all validated by the ICMR system, and more than 1,000 kits, whether it be RNA extraction, viral transport medium, or even the RT-PCR kits, more than 1,000 have been validated. Out of more than about a third are fully indigenous, and once they were approved, they led to the decline in the price of the international kits, and then we had so much excess of these kits that we started exporting them. We were innovative also in the testing strategy. We used the tuberculosis platform, which is the TrueNat platform, again a purely indigenous platform developed for tuberculosis. We validated it for the first time for COVID-19 in March, April, and we used it and deployed it across the country. Now more than 2,500 COVID TrueNat testing kits have been established in the country, and they have tested more than 5% of the total 17 crore tests, whilst these TrueNat molecular diagnostic tests have just been developed in the UK in October, and they have just started 200 or 300 of those machines for testing COVID-19. So we were innovative in terms of newer molecular tests, indigenous kits. We early used the rapid antigen tests in June when we had a peak in Delhi, and we used those kits and found that they were quite sensitive, up to 70% sensitive and 100% specific. So we were able to deploy those kits in large quantities in the country, and they got emergency use authorization by the WHO in September, October, but we were ahead of the curve. So from that perspective, it has always been a preemptive, proactive, whole of the government science-based approach,
right,
wherein we have had such a strong leadership which has been communicating with all the states, communicating with all the union territories, and been able to keep them together to work to fight against this pandemic.
Right, sir. So now
even for I've told this little story about the testing kits. We have a similar story for oxygen. We have a similar story for PPE kits. We have a similar story for N95 masks. We have a similar story for ventilators. So I think a huge effort from all the ministries of the government which have worked phenomenally to tackle this pandemic.
Right. So now the vaccine is here. We are ready to start the vaccine very soon. So how can you share a little bit how government plans to roll out the vaccination? Dry runs are being done.
Yes. So you have covered from your press. You have covered the dry runs so well, and they have been quite successful without any incident in all the states that they have been done. We have a very robust COVID software. The Ministry of Health has been working day and night to develop strategies of how the deployment will happen in an election mode. And again, India is more innovative than many parts of the world. We have been able to do elections so well. Similarly, we have the capacity with our good engineers, with our good IT background. We have this software. So we should be able to tackle this deployment of this vaccine in a robust manner. I see no reason why we shouldn't do well. We have a promise of doing about 30 crore vaccinations by June. Hopefully, and I keep my fingers crossed, that even before that, if we can break the chain of transmission of the virus, we may not have to vaccinate the entire population of the country.
Right, sir. So when can we hope that first dose would be given to the public?
I think it can be very soon, within a week, 10 days. I would say week to 2 weeks it should happen, and that is the Ministry of Health to decide and to do that.
Right.
Because everything is ready in terms of the approval, the drug, the vaccine, the syringes, the patients, as well as the apps and the the systems for deployment of these vaccines. They're all ready, including the vaccinators.
So now vaccine is here, everything we are ready that you can't be careless.
Yeah,
Even
absolutely, absolutely. I think this is a great day as far as India is concerned and the world is concerned, and also the low middle income countries are concerned. We will be able to supply vaccines to them as well. But more important to remember, even we do not know a lot of things in science, and when we do not know, we say we don't know it. We do not know how long the vaccine is going to be effective for. We do not know how much of the population we'll have to vaccinate to break the virus transmission. But what we know is that what up till now that we have been able to control the pandemic in this country is by the COVID appropriate behavior of the use of mask, maintaining proper social distancing and hand hygiene and that has to continue, and I am of the opinion that masks will probably be the last to go and probably may never even go.